those are usually the guys who end up using Boldenone, especially Trenbolone, right? Size at all costs. It doesn't matter what happened to my kidneys. I want to be freaking used. Vigorous Steve here. This is the Boldenone versus your kidneys deep dive video. Is Boldenone really that deleterious for your kidney health? Should we even use Boldenone in 2023, or should we leave the Boldenone de-equipoise for the racehorses and the race camels? Let's find out in this video. I reviewed all of the scientific literature, so you don't have to. Spoiler alert, it does appear the evidence is very compelling that Boldenone is indeed deleterious for your kidneys, but we can poke a ton of holes in the studies that I was able to review for this video. So before we get into it, please like the video, leave a comment for the algorithm, and consider subscribing if you haven't already. Share this video with a friend who has used a ton of Boldenone and is now afraid for their kidney health, so they can review this video and determine if they want to continue with Boldenone use in the foreseeable future. And if the primary healthcare physician of you or your friend sends you in for a kidney biopsy because your creatinine levels are a tad out of range, fire them, sign up for Merrick Health, go with a competent patient care coordinator who can actually help you interpret your blood work results and tell you if you're in kidney failure or not. And if you're not residing in the United States, send your blood work to me. I'll happily do it for you and let you know if you're good to go or if you need to do additional testing. Before we start talking about Boldenone, there's something very important that you need to understand. There's a huge correlation between testosterone and the development of chronic kidney disease in men. This is very well documented in the scientific literature, but let's stick to a recent study performed by Zhao in 2020, titled The Role of Testosterone in Chronic Kidney Disease and Kidney Function in Men and Women, a bidirectional Mendelian randomized study in the UK Biobank. This study showed that chronic kidney disease has apparent sex disparity, with a more rapid progress in men compared to women. And it also seems that men suffering from chronic kidney disease pass away from complications earlier compared to women. So instead of tracking the longitudinal data of serum testosterone concentrations over years or decades, both in men and women, they used 125 SMPs and 254 SMPs for men and women to determine if testosterone had a correlating effect in the progression of chronic kidney disease. And it seems that testosterone was associated with chronic kidney disease in men and worse kidney function, while that wasn't the case in women. So testosterone was one of the identifying drivers of chronic kidney disease. But keep in mind, this study also mentioned that men, generally speaking, live a much unhealthier lifestyle. And whether that's smoking or drinking, the use of performance-enhancing drugs, the use of recreational drugs, all of those could be deleterious for your blood pressure. And if you're not managing your blood pressure, of course, over time, that's not going to be very good for your kidney health, transitioning into chronic kidney disease. And it could also be that men compared to women have a much poorer diet model, eating a lot more processed food, a lot more inflammatory food because they don't really care so much about their physical appearance. Maybe a large portion of the people in the sample size, the studied men in this group, were all dad bods, right? You have to keep that into consideration. Is this study a very accurate representation of men in the fitness community? Well, if we go by testosterone levels, we can see that a lot of men in the fitness community have supraphysiological testosterone levels, which could be deleterious for kidney health in the long term, right? So keep that in mind. The evidence is there. Androgens, by definition, are deleterious for kidney health. And it brings us to another roadblock regarding the use of anabolic androgenic steroids and their safety or deleterious effects on kidney health and renal function as a whole. When you start researching about Boldenone or Trenbolone, there's a lot of animal studies that we can pull from, because Boldenone and Trenbolone are used to improve feed efficiency and used as a growth promoter in livestock. So there's a lot of clinical evidence that we can do research on. But when you look at Primobolan, which was never used for livestock, it's barely prescribed in medical conditions for humans, if that. It's only available as a pharmaceutical in Turkey, where all of us get our Bayer Primobolan from nowadays. There's very little clinical evidence regarding animal models or human models to pull from if Primobolan is even safe or deleterious for your kidney health. There's a lot of studies performed in the early 50s, 60s, 70s regarding Primobolan in various models, all written in German. it's very difficult to draw a conclusion whether Primobolan is safe or not. And you have to keep in mind that the absence of evidence isn't evidence of absence. So even though Boldenone and Trenbolone showed that they're deleterious for your kidney health, if there's no evidence to prove that Primobolan is actually kidney safe, then we can't say that we have to omit Boldenone or omit Trenbolone and use Primobolan as an anabolic replacement because it's supposedly kidney safe. There's no evidence that it's kidney safe, or at least that warrants another deep dive. So if you would like to see a deep dive about Trenbolone or Primobolan for that matter regarding their safety or deleterious effects on kidney health and renal function, let me know down below, or join the Patreon or YouTube memberships. I will say this, and some of you guys might get triggered by this, so don't be offended. And if you are offended, let me know in the comment section. That's ultimately what it's there for, your personal diary to show your frustrations. Men, bodybuilders, fitness enthusiasts who use Boldenone or Trenbolone are probably not as financially secure as the men who use Primobolan, because Primobolan is significantly more expensive. And what I've noticed over the last 10-15 years helping people is that the men who use Primobolan are richer and smarter. Yes, you might get triggered by this. Richer and smarter, and they do their blood work more frequently. They're more on top of their blood pressure. They take care of their health better. They know that Boldenone and Trenbolone can cause all kinds of deleterious effects to their health and maybe even mess with their mental state, right? Anxiety, anger, etc. But Primobolan doesn't seem to potentiate that. So instead of using Boldenone or Trenbolone, they use Primobolan instead. And guess what? When I review all of the blood work results which I received over the last couple of years, the men who use Primobolan have much better blood work parameters regarding their kidney health compared to the men who use Trenbolone at any dose. Right? The kidney markers are significantly higher in the men who use Trenbolone compared to the men who use Primobolan. And I would say that Boldenone falls somewhere in the middle. I can't remember for the life of me that I reviewed blood work results of a guy or a multitude of guys that preferred their Boldenone over other anabolic androgenic steroids, showing that it had clear signs of kidney toxicity. I've seen 24-hour urine collection tests of men who preferred Boldenone. I've seen cystatin C tests of men who preferred Boldenone over Trenbolone and Primobolan. And it seemed all to be very comparable, maybe with a little bit higher creatinine levels, maybe a little bit altered cystatin C levels. But generally speaking, the men who use Primobolan are not the kind of guys that pursue size at all costs. Those are usually the guys who end up using Boldenone, especially Trenbolone, right? Size at all costs. It doesn't matter what happened to my kidneys. I want to be freaking used. All right, let's get into the meat and potatoes of this video. Let's start with the human studies. This is probably the best study that we have on this subject. This study was performed by Kantarsi et al. In 2017 in Turkey, titled Evaluation of Anabolic Steroid-Induced Renal Damage with Sonography in Bodybuilders. So this is performed on bodybuilders. It's our group of people, and they actually used medical imaging to determine if any renal toxicity or kidney damage was present after the use of testosterone, nandrolone, dianabol, and Boldenone. They took 22 bodybuilders from Turkey and divided them in 3 groups. Group 1 got 500 milligrams testosterone enanthate, 400 milligrams nandrolone decanoate per week, and orally 40 milligrams dianabol per day. So that's a total of 1,180 milligrams for a duration of 12 weeks. Group 2 received 500 milligrams testosterone enanthate, 300 milligrams nandrolone decanoate, and 300 milligrams Boldenone and desalinate per week, a total of 1,100 milligrams steroids per week for a duration of 16 weeks. And Group 3 didn't get any steroids, they were the control. And at the end of the 12 weeks, they collected the data from Group 1 and 2. Now keep in mind, in this study, they didn't disclose which steroid brands, which products were actually used. I'm not exactly sure if they provided the steroids for these bodybuilders to use or that the bodybuilders collected their own steroids. So now we're using a multitude of different brands at perhaps different purities, different carrier oils, maybe containing contaminants or other active pharmaceutical ingredients, or maybe not even active pharmaceutical ingredients, right? The underground lab scene is a little bit wishy-washy, including in Turkey. Keep in mind that Turkey does have a lot of pharmaceutical grade products available. I do believe that they have testosterone enanthate, decadurabolin, nandrolone decanoate, and dianabol available over the counter. But Boldenone, of course, is never FDA approved anywhere. So it's always an underground lab unless they used a veterinary grade Boldenone, which, well, let's just say that those are not up to par with pharmaceutical grade products for human use in clinical settings. So we don't know if the carrier oil was inflammatory or not, which could be a co-contributing factor to the results of this study. In this study, they didn't check the inflammatory marker, so we don't know what the high sensitivity C-reactive protein readings were before, during, and after, or homocysteine, or ferritin, or the neutrophil to lymphocyte ratio, right? We don't know that. Longitudinal blood pressure changes were not measured, so we don't know if some of these groups actually got an increase in blood pressure throughout the duration of this study. We do know that weightlifting, bodybuilding at the extreme side can cause acute hypertension, including within the kidneys. That's well documented in the literature. And when you look at the results of this study, they clearly mention that dietary and supplemental protein intake were significantly higher in group 2, which is the group that received Boldenone. When you look at the overall biometrical data of group 2, you see that the age is pretty similar to group 1, the height is very similar, but the weight, the body weight, is 10 kilos higher. The body mass index is, let's say, 4 points higher. The dietary protein intake is also significantly higher, over a gram per kilogram of body weight per day. So does that play a contributing factor in the serum creatinine levels or the blood urea nitrogen, right? I'm sure it did. Now keep in mind that the cycle design of group 1 is probably more deleterious to blood pressure, right? Testosterone, nandrolone, and dianabol. That's a recipe for high estradiol and a recipe for high blood pressure, because there's no mention of an angiotensin receptor blocker or aromatase inhibitor. And on the other side, cycle 2 was testosterone, nandrolone, and boldenone. We do know that boldenone has an inhibitory effect of the conversion of testosterone into estradiol, even though nandrolone is a significant cofactor in this process. So when you look at both cycles, cycle 1 probably had very high estradiol levels, and cycle 2 probably had controlled estradiol levels. Right? Now, we don't know the exact serum estradiol levels in both of these groups, but when you look at this as a whole, right, we can say that group 1 perhaps had higher blood pressure, and group 2 didn't have the protective benefits of estradiol, because estradiol acts as an antioxidant in the endothelial. And if the boldenone is actually inhibiting the conversion of testosterone into estradiol, and it's the estradiol that might have some protective benefits in the kidneys, maybe it's the actual testosterone that caused all of these deleterious effects in group 2 and not the boldenone, right? But we still have to go through all of the animal studies, and the animal studies are quite compelling. But these are things that I think about as somebody that is a steroid educator. And I'm sure a lot of you guys are thinking about this as well as we're discussing this study. Still, we don't know what the blood pressure is, right? There's something to say for high blood pressure in group 1. There's something to say for high blood pressure in group 2. With that out of the way, let's just look at the results. The plasma levels of blood urea, nitrogen, and creatinine were significantly higher in group 2 compared to group 1. Keep in mind that group 2 also ate a lot more protein and had a much higher overall body weight. Now, when you look at the imaging, the sonography, it is of note that the right and left kidney grades of group 2 showed increased thickness of the renal parenchyma, which is the functional part of the kidney where the cortex is, and the renal volume, the size of the kidneys, were significantly larger comparing group 2 to group 1. So this is of note. This is very interesting because, again, this is actual imaging, not just the blood work results, which we can always forego with actual more detailed testing regarding cystatin C levels and 24-hour urine collection tests, right? Because blood urea, nitrogen, and creatinine are ultimately related to the overall muscle mass and the protein intake. It is of note that the imaging shows that there's a significant difference. But is that related to the blood pressure? Is that related to altered serum estradiol levels? Or is that related to the underground lab of boldenone that was used in this study? Again, since there's no mention of a compounded boldenone undestinate as a control steroid in this study, which was actually provided to the bodybuilders of group 2, we don't know, right? A lot of things, a lot of questions that this study raises. Still, the evidence is compelling, and I would say that if you solely want to base your decision on this human study, which is, again, the best human study that we have on this subject, personally, I would say boldenone is deleterious for your kidney function because boldenone might increase kidney density, thickness, and volume, which is usually suggestive of stress or some sort of underlying abnormality within the kidneys. Keep in mind that the echosonicity usually refers to a higher density stronger SO during an ultrasound scan. And in itself, that's usually very inconclusive and typically warrants further investigation, which this study didn't perform. Now, the urine microalbumin levels and the electrolyte levels were uniform amongst all groups, which is another marker of overall kidney function. So further investigation needs to be performed, but this is, again, the only human study that we can pull data from, and the rest are case studies or animal models. So let's go through the case reports, and I'll try to go through these a little bit faster, but they're still interesting and important to mention in this Boldenone versus kidney health deep dive video. The following, performed by Winnett et al. In 2010, titled Apparent Renal Disease Due to Elevated Creatinine Levels Associated with the Use of Boldenone. This case study reports a 37-year-old British male using testosterone and Boldenone. Right? Testosterone has been associated with chronic kidney disease, and as we know from the previous study, Boldenone perhaps as well. Perhaps this British male was also using unspecified steroids, medications, and maybe even recreational drugs. This man had been to Thailand 4 months prior to hospital admittance. It's unclear if he sourced his steroids in Thailand or took steroids in Thailand, right? Keep in mind that in the UK, you can actually bring steroids from Thailand or other countries back home for personal use. So maybe this Brit actually sourced his steroids in Thailand. And I do know that in 2010, well, up until now, basically, all the underground labs in Thailand are kind of shit. I always try to teach you guys to stay away from the underground labs here in Thailand. Only use pharmaceutical grade. So you have literally 3 injectables that you can use: Rotex Medica testosterone enanthate, Bayer testosterone enanthate, and Bayer metenolone enanthate, being the Primobolan that we all love so much. These 3 and nothing else. Everything else, all of the underground labs here, they use synthetic carrier oils, which are highly inflammatory, of unknown quality. They don't perhaps use the active pharmaceutical ingredient as labeled. I had a ton of problems here with the underground labs. I haven't used them in years, and I would advise everybody out there to do the same. And if you say, well, how am I going to get my Trenbolone? Don't use Trenbolone. How am I going to get my Boldenone? Don't use Boldenone. Man, it's not that difficult, right? Love your body. As we can see from this case report, deleterious effects. Okay. This 37-year-old male was admitted to the hospital and was referred to the medical take due to perceived abnormal renal function. He had already done his blood work 5 days prior, and his creatinine levels were 3.82 milligrams per deciliter, which is, well, excessively high. Keep in mind that he also used citalopram 3 months earlier after suffering from an acute episode of depression, which at the time, his serum creatinine levels was 1.23 milligrams per deciliter. So in Thailand, he probably didn't do anything deleterious for his kidney function, as proven by the blood work results before he started the citalopram 3 months before getting admitted. But keep in mind that citalopram can actually worsen kidney markers, and the medication isn't recommended for people with impaired renal function or kidney disease. So maybe the citalopram was actually a cofactor or a co-cause of his creatinine levels being that severely elevated. At the time of admittance, he didn't experience weight loss, dry eyes, rash, joint pains, or other issues. He didn't use non-steroidal anti-inflammatory drugs, and he specifically denied the use of illicit recreational drugs. But he did admit to the use of testosterone and Boldenone, but whatever else, we don't really know. He was using creatine supplementation up until 2 months before getting admitted to the hospital. When he was admitted, he was slightly hypertensive with a blood pressure of 130/70. He had mildly elevated white blood cell concentrations. His creatinine levels slowly came down with consecutive tests. So when he was admitted, his creatinine was 2.84 milligrams per deciliter, already a significant reduction from the blood work results he received 5 days prior. They did an ultrasound showing normal bladder and kidneys. The right side was 10.6 centimeters and the left side was 10.8 centimeters, which is a normal kidney size. No hepatitis B or C was present, and they did note that creatine fluctuated dramatically and specifically became more elevated over the weekend when he was at home away from the hospital. So he went to the hospital multiple times to check his creatinine levels, and then when he went home, creatinine levels went up. So what was he doing at home? Was he taking recreational drugs? Was he administering more Boldenone? Was his blood pressure going up sky high? Was he taking creatine supplementation? We don't really know. And the authors of this study actually suspected that he was taking some exogenous substances over the weekend, causing his creatinine levels to increase when he would return to the hospital. So even those guys knew that something was going on. They did a 24-hour urine collection test, which showed that his creatinine clearance was normal. His CPK levels were slightly elevated at 364 units per liter, which means he didn't really train that hard, right? A real creatinine phosphokinase level of a bodybuilder is over 1,000 units per liter. That's when you know you're training hard. Based on these readings, they confirmed that there was an absence of renal impairment. Now, again, this study didn't check his blood pressure over longer periods of time, only when it was admitted to the hospital. They did do an ultrasound on the kidneys, which showed that his kidneys were normal. A 24-hour urine collection test showed that he had normal kidney function. So this case report just indicates that there was a temporary increase in serum creatinine levels and liver enzyme levels, perhaps due to a multitude of undisclosed causes, right? This bodybuilder wasn't really forthcoming with what he was doing exactly, besides the use of testosterone, Boldenone, and creatine in the past. So yeah, not the most conclusive case study regarding Boldenone in relation to elevated serum creatinine levels. It did raise my eyebrows in a couple different ways, a couple different times when I was reading this case report. So let's move over to the next case report, which is not available as a full publication because it was published in the 2006 version of the Dutch Tijdschrift voor Geneeskunde. Again, my Dutch is a little bit butchery, but if anybody can find this publication, I'll link the PubMed link down below. The translation is called Rhabdomyolysis in a Bodybuilder Using Steroids, published in 2006, performed by Daniels et al. And this showed that this specific bodybuilder had severe rhabdomyolysis while using Turinabol, Boldenone, and Trenbolone. He has also taken clenbuterol tablets, thyroid medication, subcutaneous administrations of phosphatidylcholine. So this guy was definitely preparing for a contest. And in cases of rhabdomyolysis, you see that kidney parameters are severely elevated, very high creatinine, very high liver enzymes, very high blood urea nitrogen, right? A lot of these skeletal muscle proteins are actually dumping into the bloodstream, putting a lot of pressure on your kidneys. Now, this patient was treated with intravenous fluid replacement and sodium bicarbonate to alkalinize the urine and the blood for that matter, and he recovered quickly and his renal function remained unaffected. So in this case, Boldenone was used, but probably not the sole root cause of the severe rhabdomyolysis. If you can find the study, please link it down below so we can all read the full publication, assuming we can translate it with Google, because I'm well aware that not everybody can read or understand Dutch. I can, but the longer I stay away from Holland, the worse my Dutch is getting. Next case study from Sokas et al., performed in 2005. Hepatocellular adenomas associated with anabolic androgenic steroid abuse in bodybuilders. A report of 2 cases and a review of the literature. So these are 2 case reports of male bodybuilders who developed hepatocellular adenomas, which are non-cancerous liver tumors following steroid abuse. In the second case, a 23-year-old male bodybuilder admitted to using the following steroids: oral Winstrol, oral Anadrol, injectable testosterone phenylpropionate, injectable nandrolone decanoate, injectable Boldenone and desalinate. He had also severely restricted sodium and water intake and using a diuretic torsemide, a loop diuretic similar to furosemide, which is Lasix, although torsemide has a half-life of only 3.5 hours. So it's a little bit shorter acting than furosemide Lasix. Now, this patient in the second case report began showing symptoms after 6 months of steroid use and 1 month of the use of diuretics and restricting his diet, including sodium intake. So that's 1 month of daily use on torsemide. Insane. He stopped training and drug administrations and was admitted to the emergency services of the hospital in a confused state. Analytical data showed that he had acute renal failure. Blood urea nitrogen was 304 milligrams per deciliter, creatinine 10.2 milligrams per deciliter. With signs of severe muscular damage, his creatine phosphokinase was 5,500 units per liter. His liver enzymes ALT 180 units per liter, AST 130 units per liter, severely elevated. Lactose dehydrogenase 716 units per liter. And he was also hypokalemic and hypernatremic. So that means he had very low serum potassium levels and very high serum sodium levels. So besides an indication of renal failure, that also means that he had very deleterious effects on the functioning of his heart. Now, this guy was in a very poor shape. He was admitted to the nephrology unit for hemodialysis treatment to resolve the renal failure. And after diagnosis, the patient underwent 3 sessions of hemodialysis, and the biochemical values of the patient returned to normal 20 days later. So he was admitted for 20 days after this extensive stack of performance-enhancing drugs that happened to include Boldenone and Destinate. And once the acute renal failure, the asthenia, and the confusion had been resolved, this patient was discharged from the hospital. So it took approximately 20 days for him to come back within normal parameters. He did a follow-up about a year later, which showed that he had a hepatic nodule, which could be a non-cancerous adenoma or a hemangioma, for example. So again, it's very unconclusive what exactly was going on within his liver, and all of the biometrical data, right, his blood work parameters, all returned close to normal. So he had a severe health scare, right? Using diuretics for a very long time is deleterious to your health. And of course, when you're 23 years old, you're probably very gung-ho on your bodybuilding aspirations. So his dosages were probably way too high, right? Boldenone in this case was a cofactor to him getting admitted to the hospital, but I don't think that it's the sole contributing factor. In this case report, they didn't perform a kidney ultrasound or a kidney biopsy at the time he was admitted with acute renal failure, which would have been very interesting to see the state that his kidneys were in when his blood work parameters were all over the place. Again, keep in mind that the use of performance-enhancing drugs at the time was extensive, right? The kidney and liver issues cannot solely be blamed to the use of Boldenone, and an entire month of sodium restriction and the use of loop diuretics is certainly to blame, right? These are all the case reports that we have. We have 3 case reports where Boldenone is a cofactor, a co-cause that blood work parameters regarding the kidneys are severely elevated. In all 3 case reports, they were using other performance-enhancing drugs or didn't disclose the use of other performance-enhancing drugs or perhaps recreational drugs. So all we have is one single study. When you really dig into it, when you really start poking holes into it, it's not very conclusive. Still, the medical imaging that they performed in that study is slightly alarming. And when we look at the animal models, it's even more alarming because the same medical imaging used on the kidney biopsies, the cross-sections in these animal studies, show very clear changes when Boldenone was administered.